and I'm the one who is going to be moderating this event today. We are recording it so that we can offer it to other students as a resource in the future. If you're uncomfortable having your camera on, that's totally fine. But the purpose of this event is just to give our students and faculty some idea of how to access healthcare resources at the U, especially as LGBTQ individuals, and what, if anything, will be changing about the resources on offer in the coming year. I'm going to, at this point, ask my director and assistant director of the center to introduce themselves, and then ask our speakers to introduce themselves. So Dr. Vega, are you willing to give us a quick introduction to who you are?
Absolutely. Good afternoon, everyone. And thank you, Taylor, for agreeing to be our moderator today. Super excited for those of you that don't know Taylor. He is one of our student assistants here at the LGBTQ Student Center. But Dr. Vega, Dr. V, I welcome all pronouns, director for our center here. I'm very excited and very appreciative to our UHealth folks who have agreed to join us today on this very special topic. Also, if you didn't know, the LGBTQ Center has moved to its new space, and we are planning some really exciting events, so hopefully you'll be able to stop by and see us. We are located back in the Witten University Center on the second floor, suite 2300. So I'll turn it over to Mariana.
Hello, everybody. Thank you for being here. My name is Mariana Gonzalez. My pronouns are she, her, ella. And I'm the assistant director of the LGBTQ Center. I do a lot of the programming, and I also work with a lot of our LGBTQ student orgs, and a little bit of outreach. And well, Taylor wanted to spearhead this event, and that's why they've been the one to reach out to you. So thank you, Taylor.
And then Dr. Voles and Dr. Fine, are you willing to give us an introduction to who you are, where you are, what you do?
Sure. I'm Emilio Voles. I'm the Director of Student Health, and I'm here to serve all of you, our students, and thanks for inviting me, Taylor.
Thank you for speaking.
Hi, everybody. My name is Lydia Fine. I am an OBGYN within the UHealth system. My primary focus is in the care of gender diverse and transgender patients. I do gender affirming hormone therapy, surgery, and then gynecologic care as well. Thank you for inviting me to be a part of the event today. And just also want to acknowledge there's a few other UHealth providers on the call as well. We have Dr. Simpson Don, who's a pediatric and adolescent gynecologist, and Dr. Lawrence Friedman, who is also a specialist in adolescent medicine. So I'm really happy to have my colleagues who also take care of our gender diverse patients here on as well. Also Dr. Elisa Diaz, who's a psychologist and provides a lot of our mental health services. I apologize if I missed anybody on the list.
Thank you all for joining us. We're excited that we get to hear from you all on what our students can expect to actually be able to access this year. If any of you are comfortable, would you be able to speak a little bit about what you currently offer to students and how they're able to access that care, whether they have to make appointments online, call in, contact you directly? How are our students able to actually make appointments with you?
Sure. I'll start because of the student health connection. Making appointments with us, there's a couple ways you can do it. Okay. You could go to myuhealthchart.com and then log in and put in the request a new student health visit, and then you can select visit types. That doesn't necessarily, we do have a transgender visit type, but it could be any visit type, and it doesn't lock you in. So it may give preference to specific providers, but it doesn't lock you in. And all of our providers are comfortable with prescribing hormone therapy. we're actually training up. We have a new addition to our team, Dr. Reese Cargioli, who planned to be here today, but we couldn't because he's landing on a flight right now, so couldn't be here. But he is our resident expert in hormone therapy, and he's getting training through WPATH to be able to begin treatment. So right now we do continue treatment, but we don't initiate. We usually rely on our colleagues from the gender affirming program or from people's own physicians, and we continue the prescription, but we hope to soon have the expertise in-house to also initiate therapy.
May I go next?
Of course.
Yes, I'm Larry Friedman. I'm in the Department of Pediatrics at the medical school, and I don't know most of you. I know some of you, and some of you probably on the campus at Coral Gables know my programs because Mr. Alex Marino and Dr. Ann Pasquale serve as coordinators of an adolescent HIV testing and STI screening service that's grant funded and supported through the local unit of the Florida Department of Health. And I know they've had quite a few programs, encounters, health fair participation, and so forth at the Coral Gables campus, specifically addressing students there. And I'm going to put in the chat for the rest of the audience also. I know a lot of the students know, but besides testing that is without cost to students, treatments also for the STIs that are without cost to students that are supported through grants. We also have PrEP services, the pre-exposure HIV prophylaxis service that youth who are 18 and over on their own volition, and if under 18 with parental consent, can access these services. They're at the medical campus in an academic, private, confidential, pediatric sort of oriented center that's a boutique interaction rather than having students just show up to some adult location. And I'll put that in the chat so that everybody else can have that information. Thank you.
Thank you so much, especially for putting it in the chat so people can access it. Is anyone else interested in speaking on what they offer?
Dr. Sendan put something in the chat too.
I put it in the chat so that you all can see. I principally do pediatric and adolescent gynecology. So most of my patients are under the age of 18. I've, historically cared for gender diverse adolescents, and I'm very comfortable doing so. I don't do the surgeries like Dr. Fine, but I have provided hormone replacement in the past. Currently, due to state laws, that is not an option. But I also I have no problem managing menstrual suppression and other issues for our patients who have who are especially transmasculine, who would prefer not to have menses. I am very careful at this point in our documentations. I don't list visits as transgender because I'm concerned with the electronic health record system and pulls for data about security for our individuals or having things labeled as transgender for our patients. So I've changed a little bit of my practice in the last few months and really see patients labeled as hormone considerations and dysmenorrhea and painful periods, and I document using names, proper names, not any pronouns. So I'm a no pronoun person in my documentation. I just put Sam has a really hard time when Sam has periods, as an example, and keep a lot of that out, which makes me sad to have to do. But I explain to my patients and they're okay with why things are documented that way. And I'm sorry if I'm in and out. I have patients here, so I'll be coming out, but I support entirely the work of this group.
Dr. Diaz, I don't know if you're able to talk and want to jump in as well.
Yes.
Great.
Hi, Elisa Diaz. I'm a psychologist at let me put it this way, at the medical campus with the focus of health psychology. But I have been working very happily with this group for, I don't know how long now, at least throughout the pandemic. And really what I offer is any counseling services, and I also offer evaluations for clearance letters. The best way to get a hold of me or even request an appointment for me is to either email me or to email an individual called Denise Lopez. Probably you're going to find my name a little faster, Elisa Diaz. I'm the only Elisa Diaz in the whole system. So if you shoot off an email, I can kind of seg that way a little, make it more customized, because the scheduling for the psychiatry department is a challenge, and so I don't want that to be a problem. So I rather just emails, and then I can make that happen. So I'll put my email address in the chat.
Thank you. I'm going to also plug some other services that we have that I think are important. I don't see Adam on. We have a wonderful speech pathologist that we work with, Adam Lloyd, who specializes in voice training for voice masculinization or feminization. It's a really unique service that we have, and Adam is absolutely wonderful. He works in conjunction with our otolaryngologist, Dr. Rossau, who actually provides, can perform voice modification surgery. I think that kind of covers our team. I'll, again, just say what I do and how to reach me. I've had the pleasure of had a growing involvement with the Student Health Center in managing hormones for after the transition from the previous provider there. So I do gender-affirming hormone therapy, as I said, for trans men, trans women, non-binary persons across the spectrum. And my colleague, Sarah Danker, who is not on here on the call, she's probably in surgery. She's a plastic surgeon, and we lead our gender surgery program. I will put my office's phone number in the chat as well as my personal email address. Like Dr. Diaz mentioned, the easiest and fastest way to schedule an appointment with me is to send me a personal email, because otherwise that way it can expedite appointments. So I don't know, Taylor, if you want me to talk a little bit about kind of what is accessible with the current legal landscape, or if that's later on, or tell me.
That was what I was about to get to next, is that we have a lot of resources here at but obviously state legislation has made it a little bit more difficult to access some of those. So what changes, if any, should students who either want to access care or are currently accessing care anticipate seeing?
Yeah, so right now things are a little crazy, not in the best way. So with the recent passage of SB 254, which went into effect on May 17th, there's a couple of important changes that people need to be aware of, whether you receive care from us at or a provider at home or anybody. The way things currently stand is that you can receive refills of prescriptions from a provider you're already seeing. So if somebody is writing you a prescription for and I'm only talking about hormones, not any other type of care. So if you're already on hormone therapy and you need a refill, under the current Florida law, the only person that can refill that prescription is the original provider. That will be in effect until probably about 2 weeks from now, when we're expecting these consent forms to be available from the Florida Board of Medicine. The law requires that we utilize a consent form drafted by the Florida Board of Medicine to prescribe what they consider new prescriptions. And this can include the same prescription you've been on forever, but if it's being written by a new provider, then this consent form will need to be signed. So if you're transitioning your care to a new doctor, that's considered a new prescription, and you'll have to go in person and sign the consent form, and then you can resume your care based on the guidelines of the consent form. So at we're continuing hormone therapy for our existing patients, but anyone seeking to start gender affirming hormone therapy or transition providers to a new provider for a refill, that will require about another 2 weeks before that starts. And I'm sorry, I'm struggling to talk. I'm a little under the weather. I apologize. As far as surgery, the same thing applies under the new law. We have to sign the same Florida Board of Medicine consent forms. The Board of Medicine meets Friday, to finalize the consent forms, and then they'll be available for use about 10 days after that meeting. So the consent forms for surgery, it's the same thing. The consent forms will have to be signed before surgery. The current status of surgical care at University of Miami is unfortunately unclear. The university has chosen to pause the surgery program until a later point, and I can't say when. I don't know when that point will be, unfortunately.
Thank you so much. It sounds like there are many things to keep in mind for people who may be wanting to access care at the U. And will we see any difference, Dr. Voles, in things like PrEP, PEP, other care that isn't gender related?
We're going to continue to provide the same level of service. And those are, I know we talked about maybe visit types might not be the best way. And thanks for sharing that. That's a great potential strategy there. No, we will continue to provide PrEP, PEP, STD testing. We actually have now a rapid STD test. So folks, instead of getting results within 5 to 7 days, they'll be available in 30 minutes. So for specific types of tests that we can do. So that's, we can continue to provide those services. So the other thing I forgot to mention was I mentioned the online way of accessing us, but you can always, we prefer that way. Okay. But certainly you can call the student health office. That's at 305-284-9100. I can write that down in the notes, but if you just Google student health service, it'll come up. And the last way, which is least preferable, but we always take care of our folks, is you can just show up. You can just show up.
I'm sorry, Dr. Fine is under the weather because she really is an animated advocate and quite active in organizing all of us. And I really appreciate having her as a faculty member at the U.
Thank you. Yeah, I'm not quite myself today, but happy to be here.
Thank you for sharing with us regardless. So we're glad that you were able to join. I know, Dr. Fine, you're within the UHealth system, which is separate from the student health system. Is there a way students should choose between those two systems or be referred from one to the other? How does that process work? What does that look like?
I think that it's up to the students. I think that, certainly your student health team is, as Dr. Voles said, very qualified to take care of you. And I think that might be a good place to start, since that is a very excellent resource to have on campus. And then should things require maybe almost like in a consulting way to they need a second opinion or something else is needed, then I'm happy to help. As I mentioned at the beginning, I'm a gynecologist by training. So if there's any particular needs that overlap in the realm of gynecology, such as like Dr. Simpson mentioned, like menstrual suppression, those type of things that might be an additional, require an additional conversation, then certainly that I would be a good person to start with, depending on the specific needs. But I think starting with the team with Dr. Voles is a really good place to start. And then we, rely on his expertise to kind of refer from there. like I said, I can't speak to the permanence on the decision relating to surgery, but certainly anybody, and there are certain indications for surgeries that might not specifically be like related to specifically gender dysphoria, for example, but certainly still taking consults and happy to, talk about those things, even though the program is paused at the moment. So I think the specific circumstances can guide whether to start with student health or with me, but you guys have a fantastic clinic and program down there. So, and I should also say I do telehealth as well to help make things a little easier.
Another good reason to start with us is you already paid for us. So our problem visits are included. So you don't pay for that. We don't charge insurance for those. So it's a good starting point. And then we can definitely refer you on.
That was going to be my next question, which is, I don't know if any of you have information on this, but students who are on the University of Miami's health insurance, will they see impacts in what that insurance is able to cover?
I did a little bit of background research with Aetna Student Health, which represents about 60% of our student population that comes to our clinic. As far as hormone therapy goes, no. As far as coverage for surgical care, that gets hairy with the student health plan. I believe they consider a lot of that care to be under cosmetic. Okay, so that's what my understanding of it is. So. But for hormone therapy and regular visits here, that's
okay. Thank you very much. I think unless we have any student questions, that is all of the questions that I have for our speakers. So I'll open the floor if any of our guests or participants have anything they would like to ask our speakers. Who are so kind to join us today.
Taylor, you're doing great. I just wanted to let everybody know that if you do not want to unmute, you can always ask your question in the chat and we'll be happy to read it off.
And actually, in the interim, I wanted to check in and ask about name changes. I know there are specific ways we have to change our names in the systems on campus. Is there anything in particular we have to do in the student health system, UHealth system, UChart, in order to make those changes as well?
So we can put at student health at least. I'm sorry, that's fine. The student health at least we could put a preferred name, okay? But we did have an issue last week where, for example, certain parts of the record don't work with that. Like if somebody prints a laboratory label, for example, that comes up with your legal name. So we started to, based on that, now all laboratory technicians would for now we decided to just call people by last name for the lab. That way we could maybe avoid that issue. But on Epic it does show your preferred name. So usually 99.99% of the time the front desk will get it right, the doc will get it right. But sometimes when we're calling people for labs, hopefully we'll have that issue resolved.
Yeah, that's something that you can edit yourself in your MyChart account, so that you can do it before the visit. During the visit, if it's not populating correctly, the provider can actually go in and edit that as well. Anyone can edit that, but it is something you can do on your own. And for certain things, like Dr. Vol said, like laboratory result labs or other things, there's just certain things that are out of our control because they're based on the name that's on your insurance, which is your legal name. So, we do our very best, but it's not 100% perfect.
Thank you all so much. If
I want
a student, sorry, go ahead.
Oh, I'm so sorry. I wanted to add, in case there was any concern or wonder about this, people don't often know this, but psychotherapy notes are not part of the medical file. So if anyone ever feels a hesitation about seeking counseling, because of, if medical notes for whatever reason get audited or whatever, just know psychotherapy is not part of the medical file. We fight hard for that. In fact, we have had some changes made as we speak in the psychiatry department, making sure that psychotherapy notes always stay sensitive. I personally never release my notes. I don't care who requests. Even the patient, you will never get my notes. And that's just a standard thing for me. So just, in case anyone ever has any concerns about that.
That goes for the counseling center too. They're completely different medical record. So I don't get to read their notes or vice versa.
Thank you. If students have any issues, when should they report those issues and to whom should they report them?
For student health, email me directly. I can put my email there on the show notes, but just email me directly. I'm happy to be, or if individuals are more comfortable coming to you, Taylor, through the office, just forward me the email and we'll take care of it.
Cara in the chat would like to confirm overall so that they have something to tell students who ask about how to access UHealth, that the easiest way for them to get access to any service regarding gender affirming care on campus is through the UHealth app, My UHealth chart.
We have a website. Two, we have a phone number you can call to schedule. They'll ask, depending on the type of what you need, they'll go through some questions and ask you and match you to the correct doctor. I can put that in the chat. Let me see. It's 1-866 gender and then we also again have our website. So that would be a good place to start. My email was up there earlier. I'm happy to answer questions. If somebody has a question, they can email me directly too. But yeah, usually scheduling is best done by you can go through the MyChart app. Sometimes it's a little hard to navigate new patient visits if you're looking for a specific provider, so it'll be easier to call. But also, again, starting with your student health center, they have direct, Dr. Volz can contact me at any time and or any of us and help facilitate.
Thank you all. Ryan in the chat says, I'm not sure this is true, but I heard a part of the upcoming consent form in order to be on HRT said we had to be enrolled in psychiatric therapy. Do you guys know anything about this or about therapists we could access?
I did listen to the audio from the Board of Medicine meeting on Friday, where they discussed the content of the consent forms. And my understanding, which by the way, anybody can do, it's public record. It's on the Florida Board of Medicine website, the audio of all of their meetings. I think that'll be finalized this coming Friday, which anyone can also register to attend the meeting if they want. As a public participant. It's again on the Florida Board of Medicine website. I believe the final conversation regarding hormone therapy for adults, they did actually take out the requirement for yearly mental health provision. I believe, don't quote me on that. It's sometimes hard when it's just an audio and I didn't actually see it, but we'll know for sure Friday when the final documents come out.
Thank you. Is there a good point of contact for who to ask about future questions as more legislation is released or changed and as the situation changes?
It might be me, probably. If you want to, if there's any major changes, we certainly can be in communication. Obviously, that'll affect our student body. We are working very hard to reverse course on the decisions related to surgery, and I'm hoping that that will change. But I think that certainly if Taylor, I guess if you wanted to be a liaison of that information, we could work out a way of kind of communicating major changes to the larger student body.
I would be happy to do that. I know that's something Transcendence, which is the organization that Ryan and myself co-lead for transgender and non-binary students on campus, would be really happy to share that information with our students.
Great.
I know the students are mostly adults already over 18, but the Florida chapter of the American Academy of Pediatrics is also lobbying and advocating for the removal of puberty blockers from that list of banned substances for medical providers to actually write prescriptions.
Do you happen to have contact for people who might be interested in getting involved with that effort?
You mean at the Academy of Pediatrics?
Yeah, I'm not sure if students would be able to help support that effort. But...
Yes, I would have contact information.
Okay.
And I'm on the email too, just in the global directory.
Perfect, thank you. That appears to be all of our student questions.
I have one quick question.
Oh, okay.
First of all, I want to thank everybody for what you've been sharing and all the resources. I'm really happy to see that we have about 3 of our LGBT affinity student group leaders that are here. So we're hoping that you can take a lot of this information back to your groups. I think one of the things that I just wanted to throw out there as a question and see what else you had. I know that Dr. Diaz, you shared, about your notes. Dr. Simmons Sandan shared a little bit about how they're not using trans in their documents, so that little tips, big tidbits, right? And since our students are always looking for ways to know what's some helpful information, I was just wondering if anybody else had any other tips that they could provide this group that we could get to our students as they seek out their support, their help, their professional care.
Well, one thing you could always stress is the confidential services and the privacy that we all try to, promote in our own practices and contacts with them. There might be some fear amongst some students who are older teenagers, young adults, not necessarily understanding fully of confidentiality within medicine generally. So to emphasize that privacy part would be helpful, I think.
It goes without saying, we talked about this earlier, but we'll reiterate along the same lines. We don't share any data with the university itself. It's not like, I know sometimes people think we're monolithic, and by the way, student health is part of the UHealth system. Okay, we just happen to be located here in Gables inside Lennar, and we happen to be a student-focused clinic, meaning that our funding comes from the university, so from the academy side of the university. So, and that's why the care that you receive here for problem visits and many of that is either free or subsidized by the fees that you've already paid. So make use of your service, but we don't share health data with the university or anything like that. Nor do they have access to Epic to search our records. Nor does nor do I share medical record systems with Dr. Monteagudo at the counseling center. And now, Dr. Fine and I and Dr. Friedman, I don't think his clinic probably shares records with us, but Dr. Fine and I do share records. We don't share records with the mental health providers like Dr. Diaz. So there are some things that will, for example, if you choose to go to, a general surgeon for an unrelated issue, yes, they would be able to see your record because they're taking care of you and they can see, the medications you're on and those things, because those things are important for your overall health. So, but outside of that healthcare system, no.
Thank you. I had one last question, which is, oh wait, Ryan has an additional question in chat. Can you guys talk a little bit about PrEP and who's recommended to be on it? I know some folks who aren't completely sure whether or not it's something they should look into.
Well, PrEP is legal. It's covered by insurance companies. Minors in Florida do have to have parental involvement and consent. They can't access PrEP services on their own, but certainly anybody 18 and over can. It's recommended much more widely than a lot of people even think. It's not only for boys or men having sex with men, it's also for females who have risky or sexual encounters that might be with some risky individuals who potentially could have HIV. It's recommended for partners, sexual partners of people with HIV who, so it's a wide variety of individuals who could benefit from PrEP. It is effective, it is successful, and there are lots of access points that a lot of people might not even know about within Miami-Dade County, including in our own UHealth system. And people can always call and ask too. So I provided some information, and it's an easy phone call if individual students might have questions about it or how to go about getting it.
All our providers here are comfortable initiating PrEP. And I would, to simplify things, if you're having unprotected, meaning no condom sex, with anyone that's considered high risk or with multiple partners, you would be a candidate. But if you're not sure if you're a candidate and you think you might be, just make an appointment and come talk to us. Like I said, it's free. You can just come and talk to us, or even telemedicine.
And I should also say, few side effects. Most people don't have any, easy to tolerate, not so difficult for adherence. One pill,
I don't know if one of the things that shocked me when I started working in student health was, I'm sure Dr. Friedman and most folks here, we grew up in medicine seeing the effects of HIV on people. And, I think people have lost respect for HIV to some degree because of the treatments that we have available. They don't get to see the things that we saw kind of, in our training. So it's very important to make sure you protect yourself with, barrier condoms and PrEP whenever appropriate. Very important because that's a lifelong illness and, very unfortunate when it happens. And it does happen every year here at UM.
Yep. Dr. Danker joined.
Hi, yeah. I was finishing clinic and could not escape sooner. So
that's totally fine. Thank you for joining us. We've gone through a little bit about what services are offered at UM and how students can access those services. So are you willing to give us a brief introduction to who you are, what you offer, and whether or not our students are going to be able to access those services this year and how they might be able to do that?
Sure. I'm Sarah Danker. I'm a plastic surgeon. I'm from Miami, but I did my training in Portland, Oregon, where I received sort of a big range of exposure to various types of gender affirming care, gender affirming surgery. And so that's my kind of primary clinical interest, and been here for about 2.5 years and been offering basically range of head to toe gender affirming surgery from the plastic surgery side of things. So I do facial surgery, I do top surgery, both for trans men and trans women. I do masculinizing genital surgery, both phalloplasty and metoidioplasty, in conjunction with Dr. Fine, and also feminizing bottom surgery in conjunction with Dr. Fine. So that's my skill set. If you wanted to schedule an appointment, it would be as simple as making a phone call or sending me an email. I can forward it to the scheduling department. And in terms of having access to care, Lydia, do you want to just give me an update on?
Yeah. We talked about how the right now surgery is paused at and a lot of it has to do with the legal craziness, and we don't have a definite timeline for when it will resume.
Okay, just wanted to make sure that we all, yeah, things are so uncertain right now that it's hard to know how to respond to that question. But yeah, I'm not seeing patients, new patients right now as of today, but we are fighting it as hard as we know how to. So that's where we stand at the moment.
I know the undergraduate campus tries to get people to register to vote, and that's certainly an important thing in Florida too.
Definitely.
Yes. I was going to ask if there's anything that we as students can do to support that effort or to try and help you with that. You know of anything?
Certainly you guys are students at your voices are very important, and we encourage you to use them as you see fit and are appreciative of any support that you guys have for us.
And thank you for all the support and resources that you all have for us, because I know I didn't know about half the services offered that I've learned about today. So it's been really nice.
Yeah.
It doesn't look like we have any other student questions, but if any of you have anything that you feel like you would like to share and didn't get the opportunity to, any tips, words of advice, anything like that, please feel free. And then afterwards, I'll do some closing remarks.
So who's the, I'm again, because I missed almost all of it. So the audience is students at if who identify as trans, or what exactly is the audience? So
this is for any of our LGBTQ students who are interested in accessing care. I know from my angle, I represent both the LGBTQ Student Center and also Transcendence, which is an undergraduate organization for transgender and non-binary students. But we have some of our student leaders from other organizations that are just generally LGBTQ undergraduate organizations. And then it's also been recorded so that if we have students come into the center and ask us for information about UHealth or student health, we can refer to this as a resource.
Okay. Yeah, if there are any questions about like because things are so uncertain right now, and like the services that because there are some gray zone, gray areas. So if there are specific questions about what we are able to do now, and please feel free to just send me an email or Dr. Vine an email, and we can kind of answer those on a case-by-case basis. We're doing our best to figure out how we can, continue to care for people who need care.
I'll say we appreciate all of you. That I know that's a difficult moment for for Dr. Dink or Dr. Fine, the whole program. So we really appreciate everything you all do, and we'll assist in any way we can.
Thank you for that.
For as far as the student health service, I guess my overall message is, we're here for you. We're at Lennar, so it's I know it's next to the Wasco Arena, so sometimes people don't know exactly where we are. So we're committed to helping everybody access the services that they need. We're committed, especially to our LGBTQ population here. We're expanding the services we provide. And I know we took a little bit of a hit, losing Barrios, who was excellent. But we now have Dr. Cargioli, and all providers are definitely happy and willing to assist all of you with your needs. And, you have a direct line to me anytime there's an issue or concern, and we address it right away. So happy to see you. Looking forward to seeing everybody.
I have a question for Dr. Bowles. Do you have any psychiatry services at the Student Center?
So we have a separate counseling center. So that's Dr. Renee Monteagudo. Okay. So within that center, that's more centrally located in the campus in the student services building, I believe, right? It's a beautiful center, and they have both licensed social workers, psychologists, and psychiatrists, and a psychiatric mental health nurse as well. So they're very well rounded. Now, if sometimes students prefer to access psychiatry department, like your department, we do now thankfully have Dr. Ben, who is now doing hours here at Lennar. So he's got clinic appointments here at Lennar. So we do have psychiatry services available on campus outside the counseling center if folks require that as well.
Okay, it's good to know, particularly for psychiatry. Thank you.
Pleasure.
Thank you all so much for joining us. I know we've all taken notes on everything that's been put in the chat and everything that's been discussed so that we can share it with students who come in and have questions. And now we have points of contact for all of our students to be able to speak with the people who are most appropriate for their concerns. So thank you all for coming out, for speaking to us. This is going to be...
I'm sorry, I got late, but I just wanted to say hi to everyone. So I'm Laura Beauchamps. I am in the infectious disease department. And I don't know if you have, heard from our clinic and everything, but we are still also providing services there for our patients.
Dr. Beauchamps, can you explain what your clinic is? We were remiss in not talking about it, but it's very important. Thank you. Thanks so much for joining.
Okay, good. Sorry that I was so late. So I'm pretty sure you already know a little bit about our clinic. I was just finishing clinic today. So we're still giving services, of that gender affirming therapies and all. And we are excited to have you come and see what we do. So you can learn about our wonderful patients that we have. We see trans women and trans men there. So, and non-binary people, and we do PrEP HIV prevention, and we also do HIV care. So our clinic is just growing a lot. We have a lot of connection with community partners and all. So we just have it started like around 2 years ago, and we are here. We're trying to collaborate with other students, and hopefully in the future we can have some sort of more formal teaching, area for you. Although right now I do, have resident students that come, undergrads that do come with their interest. So you're welcome to come. I could always, leave my email. You can find me if you're interested to come in the meantime. And I'm just excited that we're all here together to continue to help everyone.
Dr. Beauchamp, can you share where your clinic is located? Because I don't think we heard that.
Yes, it's at Converge, Miami. It is on the 4th floor. So it is under the Rapid Access Wellness Clinic. And my special clinic is Gender Wellness. And it runs a couple of days a week, Tuesdays and Thursdays, but that might be changing. But right now it's Wednesdays from 10 to 3. And then Thursdays from 1 to 5, but it's going to be changing pretty soon because I'm going to be moving my HIV clinic for Thursday morning for August. So whatever it is, either HIV or HIV prevention, we'll be happy to see you there if you're interested to come.
So I think, so everyone understands what Dr. Beauchamp's clinic is. It's a very unique service that we have at It's for uninsured patients who need access to hormone therapy. There's been a lot of good studies that show that if you combine access to HIV or HIV prevention services, bundle that with gender affirming hormone therapy, it really increases utilization of PrEP, but also access to very important hormone therapy. So Dr. Beauchamp runs that program, and it's been extremely
successful. Yeah, we only had like 3 transgender people there when I started, and then we have seen over 100 in a matter of 2 years. So, and they have been retaining in care. Of course, we are doing studies there. I'm doing research there as well. So I just got another grant. So we're going to continue to study their social networks and see how we can continue to disseminate this bundle therapy in the community. So if you're interested also in helping with the study that's going to start, or any other studies that we have plenty of them about PrEP and also gender therapies and HIV in general. So please email me if you want. I can just leave my email here.
Yes, please leave your email or any other good way for students.
I'll plug my email as well for anyone that's interested in getting involved in research. I also have a pretty expansive research program that happy to welcome students. So sorry we didn't mention that before as something we do at but I'm glad that Dr. Beauchamp's reminded me. Will be a good opportunity for interested students. I know the focus of this was about your health, but we're an academic institution. So
yeah, sorry, I jumped in.
There's opportunities to learn.
Of course.
Thank you all so much. Dr. Vega, did you have remarks to share?
First of all, I want to thank Dr. Volz and Dr. Fine for helping us spearhead this. This is an event that's been brought to you by the center out of concerns that students had shared with our center throughout the year, particularly at the end of the year. A very special thank you to Taylor, who is one of our outstanding student assistants and really wanted to take the lead with moderating today. So thank you for an incredible job. For those of you that don't know, the center is part of Student Affairs. And actually, Dr. Volz and I had met as colleagues under Student Affairs to talk a little bit about some of the ways that we really wanted to reach out and sort of try to provide services and help our students find the answers that they were looking for. If you've not visited our center, we are located on the Coral Gables campus. I mentioned that a little bit earlier. We would love to have you stop by. I know that our next step is to try to sort of put the information that has been shared today in some sort of manageable way so that we can provide this for students who will be visiting the center, and in particular our incoming new students. We've been getting lots of questions, just so that you all are aware. We've been getting lots of questions in the center from parents, students who are concerned about issues of well-being and safety. So we're trying to collect and gather as much information as we can quickly. So again, thank you so much all for being here today, and I'll turn it back over to Taylor.
Dr. V has said it better than I could. Thank you for joining us all. Thank you for offering resources to our students and being committed to continuing those services for students. I know as one of those students, I feel very grateful and very supported that there's such a large team committed to supporting us wherever possible. So thank you for being willing to share this information, and thank you for sharing that information. If any of you have business cards that you're willing to let us display in the center, that would be lovely too, so that we can just hand those to people. And we'll make sure to redirect anybody with questions to whoever's appropriate. But thank you for speaking, and thank you to our guests for coming and watching.
Thank you.
Have a good evening, everybody.
Thank you. Bye.